Hello guys, I'm Konstantin.
I'm David.
We are pediatrician brothers and today we're going to discuss fever.
Yes, before we go to the definition of fever, we should mention that normal body temperature is around 37 degrees Celsius. Regarding the definition, it's kind of complicated, but whenever your child has rectal temperature which is above 38 degrees Celsius, we should say that the patient has fever.
Why do we get fever, David?
That's a question that we get a lot from parents. In most of the cases, we're getting fever because some foreign organisms try to invade our body, and as a defensive mechanism, with the help of fever, we try to fight off those bacteria or viruses from our body. And this fever also reduces their growth. We should not forget that there are some other etiological factors which can cause fever. There are some endocrinological disorders, autoimmune responses of the body, autoinflammatory diseases, or just any other condition which can impair the heat dissipation or the heat production of the body. Another interesting question is, how do we measure temperature, or what kind of thermometers can we use?
Yeah, we can measure temperature in multiple locations like oral temperature, axillary temperature, rectal temperature. In clinical practice, we always trust the rectal temperature the most, and typically it is prudent to use digital thermometers because they are more safe than the other types of thermometers and more accurate as well, especially the rectal ones. In some cases, we can use petroleum jelly for the sake of child feeling less discomfort, and also supine position is the best to measure the rectal temperature with digital thermometer, of course. Since we mentioned how to measure the temperature, now David is gonna explain to us how to control the fever itself.
Yes, the first thing that we do is we try to introduce a lot of liquids, because especially if the child is having high fever, he or she might be losing a lot of fluids due to evaporation. Second thing that we do is we try to regulate the room temperature. 18 to 20 degrees Celsius is like the optimal temperature for the room. Third thing is the clothing. We try to use the suitable clothing for the child, and the light cotton material is like the best option.
So we discussed physical factors, but what about medications? Which medications can we use in children and infants to lower the temperature down?
Basically, we use two medications. The first one is acetaminophen. It can be used from birth, and the dosage is 15 milligrams per kilogram. We can give it to the child every 4 hours. The second one is ibuprofen, strong NSAID, but we can use it only after 6 months, and the dosage is 10 milligrams per kilogram, and we can use it every 6 hours.
Since you mentioned medications, we should also discuss when not to use these medications. We typically recommend against using these medications unless child has axillary temperature above 38 degrees Celsius or rectal temperature above 39 degrees Celsius. However, if child is feeling not well, is feeling a lot of discomfort and is fussy, you can use these medications to relieve some stress and discomfort from your child. One more home remedy that can be used is external cooling with sponge, and this is an excellent method to use in combination with medications. And typically we start external cooling after 30 minutes that we have given said medications. One more thing that is very interesting for some parents is what to observe during fever and when to make an outpatient visit to a doctor.
Yes, I would say that we should pay attention to three things. The first one is age. Second one is the duration of fever, and also one of the most important things is the general condition of the child. To my opinion, every time your child has fever and is below 3 months, evaluation of the pediatrician is always a good idea. General condition is always a good indication whether or not the child needs evaluation of the physician. So let's say that if your child is feeling fuzzy, irritated, has shortness of breath, is not tolerating food or liquids, evaluation of the pediatrician is also a good option.
In regards to the duration of fever, I would recommend that every parent takes notes of the episodes of fever and when they occur, so we know exact intervals between the fever episodes. And by the 4th or 5th day, if there is no interval change, no interval increase, then we absolutely should visit your doctor. On the other hand, if the child is feeling well and if the intervals are increasing by the fourth or fifth day, and if child is eating well, is feeling active, and is better condition generally, then you can wait out and observe your child further.
So there are also several myths about fever, and what about debunking those myths?
Yeah, certain myths in Georgia is very prominent and popular that we can use nebulizer during episodes of fever, which is not correct. If child has cough and we need to use nebulization, we can 100% use nebulizers, right? We have also several myths regarding to certain vegetables and fruits in Georgia.
Yes, like the cabbage and the vinegar can be used during the high fevers. To be honest, we lack the evidence regarding those facts. So we would suggest you stick with the plan that we already discussed about, okay?
Yeah, and also mention in the comments if there are some popular myths in regards to fever in your country.
If you enjoyed our video about the fever, try to put the like and subscribe. Laters.